This is Fox 26 Morning News at 8 a.m.
Also, we're going to talk about high heels. How high is too high? Well, there are some do's and don'ts when it comes to those shoes of yours. Houston Spine and Rehab Center is going to join us with some of those do's and don'ts. Okay, let's face it. Most of the time, high heels can really hurt. But they don't just cause foot pain. The wrong shoes can lead to long-term health problems. Here to explain is Dr. Verheul with Houston Spine and Rehab Center. Good morning to you. Thanks for being here.
Thank you.
Let's talk about what's going on with this. We know that women are going to wear them.
Absolutely.
But what's your biggest concern about them?
Typically, it's just throwing off most of the anatomical issues. Is just like when you have a higher angle, is putting more weight, throwing that pelvis forward. So patients typically come in with low back pain, knee pain, foot pain, stuff like that.
If they're having low back and knee pain, they probably don't even realize it's from the high heels then, do they? Because you don't really put those two and two together.
That's right, yeah. So sometimes I have runners that come into the clinic and they'll have like calf sprain, Achilles tendonitis, and they think that they've done that from running, but a lot of times it's because of just overuse of wearing high heels while they're working.
Okay, you brought in some shoes as examples for us, just to give us an idea of what might help a little bit here. So what do you have?
Well, we have flats, which are obviously flats, and then we have high heels like these, which are stilettos, which are typically about 4 inches in height, and then we have these ones, which are 2 inches in height, and then the wedges.
Okay, so which one are you going to suggest?
Well, obviously, you know, flats to wedges are probably the best. You know, anything that's going to reduce, like I said, that angle from your heel to your forefoot is probably the best shoe to wear that I would advise. But
you see so many people wearing these. So if you're going to wear these, do you have a suggestion about how to protect your overall health and your back and your knees and everything in between?
Well, what I say is it's okay to wear these, you know, temporarily. I mean, if you're wearing them day in and day out, that's usually when patients start to have what's just overuse injuries. So if you can switch from those, like one day wear these, the next day wear a flat, the next day wear a wedge or 2 inches.
So to only wear these maybe a few times a week and keep them for those special occasions, so to speak.
Or even alternating throughout the day.
Now, is there a difference in age? I mean, are you going to be able to get by with this a whole lot more in your 20s than you are in your 50s?
Yeah.
Or do you say all the time, keep up that rule that you have?
Yeah, I would say keep up that rule. Obviously, the older you get, the more likely you're going to have age onset issues already. So yeah, something like this on a 60-year-old female would be a lot more painful than a 20-year-old female.
All right, Dr. Verheul, thank you for being here. Good advice.
Absolutely, thank you.
All right, gonna have to wear those wedges a little more. Jose.